Hello. Today we will be discussing a genetic disorder known as cystic fibrosis.
This video is created by Michael Consiglio and Lucas Olshevski.
What is cystic fibrosis?
Cystic fibrosis is a genetic disorder affecting several organs, specifically the exocrine glands. It causes the production of abnormally thick mucus, leading to the blockage of the pancreatic ducts, intestines, and bronchi, which often leads to respiratory infections, especially in the lungs. This is an autosomal recessive disorder that affects the 7th chromosome. In fact, it is the most common autosomal recessive lethal hereditary disorder in Caucasians. Aside from the exocrine glands, the respiratory system, digestive system, reproductive system, and pancreas are other parts of the body that will suffer from cystic fibrosis. How common is cystic fibrosis?
20,000 to 30,000 Americans currently have cystic fibrosis. 1 in every 2,500 children are diagnosed with it after birth, which adds up to about 1,300 new cases being diagnosed each year.
What are some symptoms in cystic fibrosis?
Due to the mucus buildup within the respiratory system, some symptoms of cystic fibrosis include pain in the abdomen, a burning sensation within the chest area, coughing up blood, shortness of breath, experiencing fatigue or the inability to exercise, and that's just to name a few. How do people get cystic fibrosis?
In order to get cystic fibrosis, each parent must have at least one cystic fibrosis allele. The child must take the cystic fibrosis allele from each parent to be diagnosed with the disorder. If a child receives a normal allele from one parent and a cystic fibrosis allele from another parent, then they will become a carrier of the disorder.
Cystic fibrosis is an autosomal recessive disorder, meaning that it needs 2 cystic fibrosis alleles in order to generate the disorder.
Is cystic fibrosis the same in every person?
No, not all CF alleles are the same. Some are stronger than others. A person who receives a recessive allele and a recessive allele will have a less symptomatic case of cystic fibrosis. Those who receive 2 dominant CF alleles will struggle to live past the age of 37 due to the severe symptoms. However, a person can receive a dominant allele from one parent and a recessive allele from another and still have cystic fibrosis.
How does cystic fibrosis affect the pancreas?
80% of patients with cystic fibrosis suffer from pancreatic insufficiency. Pancreatic insufficiency occurs when the pancreas can no longer produce the food digesting enzymes that break down and digest our food. Pancreatic insufficiency leads to a higher risk of diabetes, weight loss, diarrhea, and more. Is it possible for people with cystic fibrosis to have a child?
People with cystic fibrosis can have children, but are very unlikely to do so. This is because, for males, 98% of them are infertile because the cystic fibrosis causes them to not have the vas deferens. Similarly, for females, they often struggle to get pregnant due to mucus buildup in the vaginal canal.
What kinds of treatments are there for cystic fibrosis?
Unfortunately, cystic fibrosis does not have a cure, but antibiotics and other medications can ease symptoms and reduce complications.
Some of these medications may include pancreatic enzyme supplements, multivitamins, mucolytics, antibiotics, bronchodilators, anti-inflammatory agents, and CFTR potentiators.
Besides medication, what are some other safe ways to relieve symptoms?
Heavy breathing and the use of nebulizers loosens up the mucus and tension within the lungs. A nebulizer is a machine that patients will wear over their mouth, and it pumps water vapor into their respiratory system, which loosens up the mucus and relieves pain. What kind of environment would a person with cystic fibrosis thrive in?
Dry and non-humid climates are the best environments for people with cystic fibrosis to live in because humidity makes lungs work harder than they have to breathe, which creates more tension in the body. What factors of the environment play a role in increasing the severity of the symptoms in cystic fibrosis?
Smoking negatively affects the lungs of all people, regardless of whether they have cystic fibrosis or not. However, people with cystic fibrosis generally suffer from weak lungs due to the mucus buildup. So when smoke enters their lungs, it only damages them further.
People with cystic fibrosis are constantly suffering from allergies. Allergens such as cat hair and dog hair make them begin to cough and sneeze. It is still possible for people with the disorder to enjoy domesticated pets as long as they are shed-free and non-allergenic.
How would changes in the season or the spreading of pollen affect someone with cystic fibrosis?
A person with cystic fibrosis is much more severely affected by the allergen pollen than a regular person is. This is because with the exposure of pollen mixed with the buildup of mucus inside the body, more infections are likely to occur, especially in the lungs. To prevent this from happening, it is very crucial for people with cystic fibrosis to close their windows as much as possible, especially during allergy season, so they reduce exposure to pollen. Similarly, mold is another allergen that is very dangerous to people with cystic fibrosis because it is responsible for clogging up the lungs, which can lead to specific illnesses such as bronchitis and pneumonia.
With all that being said, would you consider nature or nurture to be the stronger determining factor of cystic fibrosis?
Even though there are many environmental influences on cystic fibrosis, it only affects the people who actually have the disorder by increasing the risk of health conflicts and creating more severity of the symptoms. Therefore, nature is a stronger determining factor than nurture because the environment cannot possibly cause a person to have cystic fibrosis, whereas genetics is the only factor that can determine if a person receives it or not. Cystic fibrosis is a... Are you kidding? I didn't...
Of diabetes, weight loss, diarrhea, and other things.
Dry and non-humid climates are the best environment for people with cystic fibrosis.
What is cystic fibrosis?
You need to leave. You gotta say it and leave.
Pancreatic insufficiency.
Unfortunately, cystic fibrosis does not have a cure.
In the use of nebulizers.
Unfortunately, cystic fibrosis does not have a cure, but with the use of unfortunately, cystic fibrosis. Let go.